on the Mobility Radio 104.9 FM in Abuja, bridging the information gap. I am Trish, your host of the most. World Stroke Day is observed annually on October 29th to raise awareness about stroke, its prevention, and treatments. This year's theme is hashtag greater than stroke. To join me on this conversation this morning is Dr. Chijoke Otipa. Good morning, doctor. How are you?
Absolutely fine.
Okay, I
How
can
do you
see
do?
it. I can see it from your face. I'll be on your face here. Is it from Abia on?
Anyone?
Welcome to Health and Well Show, Democracy Radio, Water for Provider from Abuja. Trust you're doing good.
Absolutely.
Okay, so 15 million people. This is really something. 15 million people suffer from stroke annually. This is coming from the World Health Organization. And also, the World Health Organization is saying that 6 million people die from stroke each year. 50 million people live with stroke related disabilities. And also, let's take a look at stroke fact. Okay, one in four adults will have stroke in their lifetime. This is also coming from the World Health Organization, which is WHO. Stroke is the second leading cause of death globally. World Health Organization is also saying this. 80% of strokes can be preventable. Now, timely treatment can reduce disabilities and deaths. So, doctor, hearing all this analysis, statistics, and facts, what is stroke and how does it affect the brain and the body?
Okay. So, stroke is a medical condition,
Mhm,
you know, characterized by some deficits,
mhm.
particularly neurological deficits and sometimes musculoskeletal deficits as a result of injury to the brain.
Okay.
So it's more like an assault or, an accident that happens in the brain that kind of shuts down blood supply to a particular area. And then that can eventually affect, you can start talking about sensory or motor deficits
Yeah.
that come with it. So that is basically what it is. And then, this is usually for you to be able to call it a stroke, it has to be something that has persisted beyond 24 hours.
Mm.
So when I start talking about the types, I'm still going to kind of differentiate
Yeah.
them based on that.
Yeah. Yeah. Okay. So, what are the most significant risk factors for stroke?
Okay. Now, the risk factors are they are divided into two,
Okay.
right? There are two risk factor categorizations. One is the modifiable
Okay.
risk factors, and then the other one is the non-modifiable risk factors.
Okay.
And basically, what it means is, the modifiable risk factors are the ones that can actually be adjusted.
Mhm,
Okay, they are the ones that the individual has a control over,
mhm,
right? But then the non-modifiable risk factors are other things that you may not really be in control of, which are maybe rheumatological diseases that are existing. It could be genetic factors that can contribute to the likelihood of having strokes. Then when it comes to the modifiable risk factors,
mhm.
that's where we have things like obesity, we have diabetes, we have sedentary living. We had a talk here about sedentary living and
Yeah. Yeah.
physical activity and all
I think
that. That's
we're
also
going to have a repeat of that one of these days
no
because we
problems.
need to talk about it. The festive period is coming,
Yeah,
and people have been working for a long time, so that's that time we need to exercise a little bit. But we'll
yeah.
talk about it. So back to
So
stroke.
those are the modifiable risk factors. Another one, very common ones that are usually very ignored by people, is smoking
Mm,
and alcoholism.
mm,
Too much usage of alcohol and then smoking of any kind, whether it's active or passive smoking.
mm.
You live in an
Honestly,
environment that smokers, they're always doing their thing.
yeah,
So you are passively taking it in as well. So
yeah,
that's like a modifiable risk factor
Okay.
for stroke.
Okay, that is really, really interesting. Thank you so much, Dr. Chijoke, for that very enlightening explanation. How could you explain the different types of stroke?
Okay, there are basically three broad categorizations, three broad types,
Okay,
and the first one is the ischemic,
what?
ischemic,
Okay.
ischemic, like ischemia. The
Oh, I thought you
second
were
one,
saying it's scary. Your voice is scary.
the second one is hemorrhagic.
What?
Hemorrhagic.
Okay.
Though I'll explain all this.
Please, because my head is just going on one side.
Sorry.
I'll tell me.
Then the third one is transient ischemic attacks,
Oh, wow.
TIA.
Okay.
Now, the first one is ischemic. So
Mhm,
ischemic is basically blockage of blood vessel.
mhm,
The brain has its own blood supply.
mhm.
So now different parts of the brain, they need the blood supply to to get oxygen and nutrients that they need to function and all that. And if you remove oxygen from a tissue, if you remove oxygen and if you cut out nutrient supply, that tissue is going to start dying, right? So brain cells need the oxygen to keep thriving.
Mhm.
Now, what happens with an ischemic stroke is just like when you have water pump or water tube or hose, taking water to wash your car,
And
for
then you block
example,
it.
and then something just blocks it.
Oh,
Maybe sand or leaf or something blocks it,
that's
and it
really
shuts
scary.
down the supply of water, right? So
Yes.
that's how an ischemic stroke happen, usually
Ischemic
through due
stroke.
to due to plaques, and this can be fatty tissues that are accumulating in the bloodstream,
Hmm.
and then there can be an injury setting up there, and then it sloughs out.
Mhm.
It comes out from the site and goes to block a blood vessel in the brain. So
Hmm.
now there's not enough oxygen supply to certain tissues or regions in the brain,
Mhm.
and then nutrient supply is also cut out. Therefore, that region starts to die out.
Mhm.
So it begins to shut down.
Mhm.
Now, there's the other type is hemorrhagic.
Hemorrhagic.
Just like hemorrhage,
Okay.
it means there's excessive blood flow somewhere that is
Okay.
unusual. So
Oh,
there
okay.
could be a what we call vascular aneurysm.
Does it work with internal bleeding, something like that?
Yes.
Oh, okay.
So there's something we call vascular aneurysm. So like a blood vessel can actually get weak at a point, an artery in the brain, and then burst.
Hmm.
And when it bursts, it can splutter on the brain cells. One, cutting out the oxygen supply as well, cutting out blood supply to the regions that should have received that blood, and then two, increasing the risk of having blood clots in that area
Okay.
pressing on the brain. So now the final one is transient ischemic attack.
Yeah.
So this is like an experience of stroke, not necessarily a stroke, but it could be a warning sign of future strokes. But then symptoms that persist and dissolve, they just go within a few minutes to hours, but typically within 24 hours.
Mhm. All right, so we're not here to scare you, but we're just here to let you know that these things are real. It happens. It's just for you to take good care of yourself. Be aware of your system, your body, because on Health and Wealth Show, what we basically do here is um, educate ourselves to having a healthy lifestyle and also being mindful of what we eat and also taking good care of our mental health. All right, this is the Group AC Radio 104.9 FM Abuja, bridging the information gap. Trish is my name, and you're listening to Health and Wealth Show. All right, so if you have worries, questions, or observations you want to share with the doctor here in the studio, he is a physiotherapist and also a holistic life coach. His name is Dr. Chijoke. You want to ask questions, you want to know more information. Maybe you have someone who has suffered stroke before or who has symptoms and you want to educate them. This is the platform you don't want to toy with. All right. So what I want you to do now is call us up and ask your questions. Okay. 0810 885 1189, and also the WhatsApp line for you to send in messages. Also, voice notes is 0906 199 9009. So let me use myself as an example this morning, doctor.
Mm-hmm.
My late dad suffered a stroke for the first time, and then he had the second one, and then he died. So I didn't know all these things. Actually, I knew a little, but not too much. It's good to say the truth when you say it. All right, so let's move into recognizing stroke symptoms and also what are the common causes of stroke and what are we've already talked about risk factors. So
Mm-hmm.
what are the common causes of stroke and also how can one recognize stroke symptoms?
Okay. So let me start with the causes,
Mhm.
because the risk factors can eventually become causes. So the cause of stroke is basically linked to the types. So it could be as a result of a blockage blockage of the blood vessel that is meant to take blood to a particular region of the brain that's ischemic. Then it could be as a result of bursting of the blood vessels that taking blood to that region, which is hemorrhagic, right? And different things can cause this. Obesity can predispose one to having a stroke.
Okay.
Fatty tissues accumulating in the blood vessels and then sloughing off from there and going to block the blood vessel, can also predispose one to strokes. And there are other conditions, other disease conditions that may also increase the risk of one having a stroke, right? But sometimes it may not be so easy to point a finger and say that this is a particular thing that
Yeah,
caused
okay.
that stroke. Hypertension is one of the direct causes, of stroke on improperly managed or unmanaged hypertension, can actually increase the pressure on the blood vessels and, lead to the bursting of the vessels and all that. So other things like diabetes mellitus, and some other disease conditions that can lead to that. Now, the second thing that you asked, what are the signs, right? The signs that you can see to tell that, oh, somebody's about to have a stroke, right? Or somebody's experiencing that the stroke, someone is about to experience a stroke. These signs include, I'll use an acronym here. The one that we usually know, the one that is commonly known is fast, the fast protocol. Okay. And that's like part of what they're going to teach you in first aid and all that, so that you are able to recognize and call for help. And F is face. So if you have the face drooling to one side.
I think I remember F as it's fast.
Yes, yes.
FAST.
Exactly.
Yeah.
Exactly.
Okay.
So face dropping to one side, one side of the face is kind of dropping, and it seems like the other side is firmer or pulling to one side. That's a sign that something is going wrong. Now, the next one is A, that is arms. So if you ask the person to like take up the arms, both arms, take both arms up, at that time that he is probably experiencing some of the things that you are seeing that are unusual, you may find out that this person is able to take one hand higher than the other one. So they are uneven. So there's one arm that seems to be stronger than the other, right? Or take your hands up, and then one hand begins to drop, and then the next one is S. Speech, slurred speech. So somebody who used to talk very clearly before, who used to be very vibrant, presenting, talking, shouting at the kids and all of that, and then all of a sudden he wants to say, "Get me the cup," and it's like, slurred. The speech begins to slur. Exactly.
Difficulty speaking.
Exactly.
Or understanding.
Exactly.
Okay.
Now the next one is T. Time to call 911, or whichever one works for you. Time to call 911, time to call for help, time to call for emergency. Exactly. Act quickly. Take the person to the hospital as soon as possible. Now, that's the one that we commonly know. However, recently we have begun to see that there are some other signs that may, this I don't know how to break this down, but posterior circulation strokes can be detected earlier by adding these two acronyms, B, before the fast. So like be fast, right? And the B is balance, right? So all of a sudden somebody gets up and is not able to get himself. It's like he's falling, he's staggering, cannot walk in a straight line or something like that, trying to always hold something. And then the next one is eyes. So eyesight, vision issues, not being able to recognize items in one side, or dizziness. It seems like, oh, this place is turning. My eyes are, yes,
Every time.
everything is just
Why is
spinning.
everything turning around?
Exactly. So those are some of the things that we can look out for.
Okay.
It may or may not mean that the person is actually having a stroke, but it is best to actually act fast and be fast.
Okay. Let me take you back a little bit to risk factor. What about family history?
Yeah. That was why I talked about genetics. Yeah. So there could be, what usually happens is, when there is a family history of strokes, there could be an indicator that there are certain factors in a person's bloodstream that would predispose them or increase the risk of actually having a stroke. It's been shown, so that's where that comes in. That's why I mentioned genetics as one of the risk factors, genetic predispositions.
Oh, okay, that is good. All right, so can stroke be prevented? If yes, kindly explain what people should do to prevent stroke.
Okay, so basically, the answer is yes. Stroke can be prevented.
Okay.
And what people need to know to be able to prevent stroke is simply understanding of the the modifiable risk factors, certain lifestyle changes. And I would say at this point, if you're already having certain conditions that are risk factors as well, like diabetes mellitus, obesity, hypertension, these are things that you should face squarely and work on. Talk to your doctor, take your prescribed medications when you should actually take them. Then lifestyle changes, eat well, reduce stress, sleep well. These are things that we usually ignore. A lot of people get too stressed that it begins to build up and increase their blood pressure, which is also a direct risk factor. Now, for some people,
Well, here in Nigeria, stress is one thing. You're going to work.
Stress is like food.
Do you get? So how now do you tell someone to manage stress?
Because
it's not easy. Being honest right now,
yeah,
it's really not easy to say, okay, manage stress. So I think you should just chip it in. How do you think I can manage stress?
I understand you, and sometimes it's almost impossible not to get stressed at some point, because then you have to meet up with a lot of things. You have deadlines to meet. You have to, your urgent 2K or 10K. So, so now, managing stress doesn't have to be so complicated. Know when to say no, know when to turn down certain things, set boundaries around your life, around your business, around your work, right? Don't overdo when you know that you are not able to. You're not really working to impress anybody. You're working because you have value, and you have value to give to whichever organization you are in.
I like that.
Now, yeah, and then you should know how to set boundaries. You mustn't do everything for everybody, right? So try as much as possible to cut down activities. Prioritize activities that really make more sense to you, that move the needle for you, that make money for you. And then, then the next thing I'm going to say is there are some other things that you can do to relieve stress. Go hang out somewhere, look at nature, walk on the grass, just have some fresh air, barefooted, have some fresh air, take deep breaths. I do this a lot. Because sometimes, people look at me and they're like, "Oh, you're a young guy. You don't understand." Sometimes, man, this is a lot. This country is a lot. So sometimes I just take very deep. In fact, it has become second nature. Like, I don't know when I do that, but sometimes I'm just so overwhelmed. I just take deep breaths and I do it like 3 times, 4 times, and I feel a lot better.
I think what I basically do is I meditate a lot. I just stay in my room, my space, close the blinds, listen to soft music like Yanni, right, or Enya. Listen to those instruments and then just close your eyes. In the process, I will sleep off. I'm telling you. And that day, it is refreshing for me.
Oh,
so
that's
I think
nice.
you can also do that if you're listening to us right now. In case you just tuned in, I want to welcome you, the brand style. This is the Health and Wealth Show. Now, this show comes up this time at the station. And of course, there's a repeat broadcast on Saturday from 9 a.m. to 10 a.m. Only on Democracy Radio 104.9 FM Abuja, bridging the information gap. Yesterday was World Stroke Day. So we decided to talk about it today. So in case you missed it out yesterday, we're talking about it today so that you will know that we have you a heart. Remember, this year's theme is greater than stroke. You can fight it, you can prevent it. That is why we're talking to you this morning. You can join in this conversation right now, ask questions, make inquiries. We are here for you. 0810 885 1189. That is the studio line. You can call in so I can hear your amazing voice. And you want to send in WhatsApp messages, feel free to send it to 0906 1999009. Do also follow us up on all our social media handles, Facebook and Instagram at Democracy Radio. And on X is Democracy Radio underscore. So, Dr. Chijoke, let's move into your profession as a physiotherapist. How does physiotherapy support stroke rehabilitation, and what other stage should and at what stage rather should it ideally begin? Because it's really important to talk about it.
Okay. So, stroke management, first of all, is a multidisciplinary team management.
Okay.
It's not left for just one side, right, of healthcare. So, for us as physiotherapists, it's very important to integrate physiotherapy early in stroke management.
Okay.
Why? When we come in, we initiate mobilization early. What do I mean by mobilization? Movement.
Mhm.
Remember, I always sing this like an alarm clock. Motion is medicine, motion is lotion and movement is medicine.
Yeah.
So motion is lotion, meaning that we come to frequently, even from the point of admission. So we have had cases, we get invited while a patient is still in the ICU, in the intensive care unit,
Yeah.
to prevent prevent complications.
Okay.
I'm trying to avoid medical jargons here because I know,
Why are you but I think you can say that you
Yeah,
I think it
okay.
should be better.
So,
Because like I always tell you, when you come into the studio,
mhm.
I am not here to
Adhesions, tightness of the joints or whatever. So by frequently engaging the patient while they are still on that phase of recovery, at that acute phase, we can help with something called neuroplasticity. Okay, so now this is basically the brain trying to recover. With the injury or insult to the brain, there's some damage that's been done, right? So there are cells that are already on the process of cell death, or cells that are dead already. Now, what we are coming to do is to slow down that process, to help with recovery, faster recovery of the cells around that one that is already dead, to help them take over the role. So by doing movement on the peripheral, the joints, the muscles, and all that, we can send signals back to the brain that yes, this part of the body is still alive. Okay, and that's why it's important to integrate physio early. Now, other things such as ambulation, right?
Okay.
Getting the patient to actually stand and move.
Mm.
This depends on the level of the stage of the recovery and from our own observation of that patient, because every patient is unique. Now, when should physiotherapy be invited? As early as 2 to 3 days after the patient has been stable.
2 to 3 days.
Exactly. So within the first, in fact, within the first 24 hours, as long as the patient has been stabilized, the physio team should be invited as early as possible to come around assess the patient, and start initiating treatment, initiating movement, and then planning the patient's eventual recovery journey and discharge. So that is basically, the
All right.
purpose of inviting.
2 to 3 days after the patient.
1 to 2 days. Sorry.
1 to 2 days.
24 to 48 hours.
Okay, 24 to 48
Yeah.
hours after the patient
Has been stabilized.
Okay, you are listening to Health and Wealth Show on the Frequency Radio, 104.9 FM Abuja. And if you check your time, you see it's that time for us to take a breather. And when we come back, we still have more questions for Dr. Chijoke. We're talking about stroke because we're celebrating World Stroke Day. Remember this year's theme is very simple and straight to the point. Hashtag greater than stroke. Good morning. All right, so we're going back. How is it going? How is it going? Good?
Yeah,
So
good.
we're going back. We're almost done with the question.
So, which other?
The
Okay.
ones you sent to me?
Yes.
Yes. So those are the ones I'm asking you.
Okay.
So, let me just give you a quick
Yeah.
recap.
Then
The next one is
have I talked
stroke
about
recovery.
multidisciplinary
That's
team?
what I want
Okay.
to do. So stroke recovery requires a multidisciplinary approach. So that's the one I'll ask you now. Thank you for staying tuned. I'm glad to know you're still there. In case you just tuned in or this is your first time, welcome, welcome, welcome. All right, this is Health and Wealth Show. We're taking a look at World Stroke Day, okay? Because it's celebrated 29th October annually. All right, so this year's theme is hashtag greater than stroke. And I have Dr. Chijoke Otiba here. He is a physiotherapist and also a holistic life coach. So, doctor, stroke recovery requires a multidisciplinary approach, right? Could you explain the role of other professionals like speech therapists and occupational therapists in the treatment team?
Okay. So it's important to note that, like I said earlier, it's an MDT thing. It's a multidisciplinary team management that is suitable for stroke rehabilitation. Now, from the get-go, the patient gets admitted, gets triaged, sent to where they should go for the beginning of their treatments and all that, stabilization, resuscitation if there's need. The medical doctors, they come attend to the patients. Then other team members get invited as well. Now, for the speech therapist, for example, so there are other members of the team, right? The nutritionist or the dietitian, the speech therapist, the occupational therapist, even the orthotist and prosthetist. And who are these guys? The ones who fabricate, different things like splines, to help with maybe walking, slabs to help with posture and all that. Now, the first one I mentioned, the dietitians, right? So sometimes the stroke patients can actually have some difficulties with their diet, right? So they may not be able to even take some of them may reject certain foods, so a dietitian may be able to work better with them to actually give a meal plan that will be suitable for them.
Okay, so you're saying that once a stroke patient recovers, he or she has the difficulty in digesting some certain food. That is why the dietitians come into play.
Yeah. So, there are other reasons, but it's not every patient. Remember, I told you every patient is different.
They're all unique, yes. Right? I understand. So it is important that you taking care of a stroke patient, you the caregiver, that's in case they go home, maybe the wife or the mother or someone, should understand this.
Mm-hmm.
This is important. This is really nice. This is new. I just learned it. Thank
Mm-hmm.
you.
You're welcome.
Thank you. No, no, no. It's serious. I'm serious. I'm not joking.
Oh,
But this is really important.
yeah.
So, wow. That was what I could. Oh, wow. Thank you. So you see, we learn every single day. That is what we're here for you. Feel free to call in to also ask questions because it's important. The WhatsApp line is open for you. And also the studio line is as well open for you. Call in 0810 885 1189 in case you have questions or maybe observations or you just want to share your experience. We would love to hear from you, okay? And then the WhatsApp line is 0906 199 9009. Let me see. Oh, oh my word. Please do well to call back, okay? Do well to call us back right about now. 0810 885 1189. That is the studio line. You can call in. So, doctor, you're explaining.
Okay, so like I was saying,
Yeah.
the role of the speech therapist goes even far into training on swallowing.
Mm.
Difficulty swallowing. The speech therapist can help to coordinate certain exercises that can help improve the patient's ability to swallow.
Okay.
Right? Can also start integrating speech training. As early as possible, because some patients equally, depending on the part of the brain that is affected, some patients have those speech difficulties, right? And the speech therapist can start integrating speech training that early. Now, the occupational therapist, majorly reintegrating the patient back into society, back into work, back into their homes, adjusting to how their homes look, the setup and everything. So it's like important to look at it from a holistic perspective. Some patients as well come down with mental health issues. In fact, a lot of patients, a large majority of stroke patients come down with mental health issues, anxiety, depression, because all they used to do, this is someone who used to be very active. They will tell you, oh, I played golf, I played professional football, I did this, I did that. You know me, this is hurting me, because I can't do all the things that I used to do before. Now they are feeling stuck in that new life that they are not used to, right? And a psychiatrist may have to be involved at this point.
Really?
Yes.
Wow.
So that is basically how the whole team. So every
That's a
professional
whole lot
can
of
identify the need for another professional and request for, or maybe talk to the consulting, the referring doctor or the team in charge of that patient, and then get other members of the team involved.
With all this, it sounds very expensive. Very, very expensive. So imagine some persons right now who isn't so rich, who doesn't really, as in who is not so buoyant and all of that.
Mhm.
How can they manage with all this?
Well,
Yes, that debate is really needed.
well, to the best of my knowledge, right? Medical care currently it's quite over the moon. It's quite expensive.
So how
Um,
can the middle class, lower class manage with all this?
well, I think it's going to be easier to manage in tertiary institutions, tertiary hospitals that are public hospitals, general hospitals and all that. Some of them offer really
Affordable.
affordable prices for different things that they do, or things that can help the patient. So what I know will be on the very much high side is going to privates and all that. But then a lot of the general hospitals, they actually have very affordable programs, and there are also stroke rehabilitation centers that have the whole team thing available and all that. But it depends on, I feel like, not that I feel like, I'll always recommend, go with what you can afford. Somewhere you can get excellent care that is still affordable for you. Okay? Somewhere that you can get good enough care and it's affordable. And I would also recommend, granting subsidies for medical bills, one way or the other. I know these things are possible, granting fundings for, I think that's where social work comes in. Social workers actually can help patients who are not able to afford certain bills, and then they can help them source for funds, crowd fund, and then set off the bills. So that's what I would say
All
for
right.
now.
So talking about social workers and all of that, how can we support stroke survivors and also caregivers?
Okay. So I'll say a few things. One is, of course, helping out with offsetting certain bills,
Mhm.
because it's expensive. It's expensive.
It
I'm
is.
trying not to say that. I'm trying not to say that,
But
but
your honesty is very well appreciated.
yeah, it is. It is. It is. Generally, medical care is expensive, but stroke in particular, the burden, the cost of management can be it can be off the rooftops. Now, setting of bills, then talking about emotional support, psychological support. You don't need to have experienced something um before you can encourage somebody else who is experiencing it.
Mhm.
you know Sometimes all they want to hear is that, oh, you're going to be fine, relax, it's okay. Now, everybody can render that emotional support.
Mhm.
But the best thing you should do, I mean, even if you do not know what to do, I'm talking about the psychological aspect now.
Mhm.
Even if you do not know what to do,
Mhm.
it's better not to do anything. I mean, it's better not to come and mess things up, right?
Mhm.
Now,
Mhm.
you can see, we live in a country where people do competition with suffering. So somebody has a stroke, is probably having crying spells. They are probably depressed because of the condition that they are in.
Mhm.
And you see another person who comes to tell them, oh, this thing, don't worry, it's not a big deal. At least you can still walk. At least you can still do this. At least you can still eat. How about those that died?
Mhm.
How about those that this? How about, it's not the right approach,
Okay.
because you are literally making them feel like, okay, you are pushing it on their heads or before them, that your condition is not really that serious,
Okay.
but they know what they are going through. So do not underestimate their pain or their frustrations. Offer help where you can. Offer encouragement, a lot of encouragement. And then the caregivers, the burden of stroke care, a lot of it lies on the caregiver.
Hmm.
People may not realize, and this is where I'll also appeal to health professionals,
Okay.
whether medical doctors or physiotherapists and all that. Sometimes it seems like they are doing an easy job. After all, it's your dad. After all, it's your, whatever. After all, you're employed for this, or but this person also has a life, that for some of them, they had to pause their life, they paused their academics, they paused their businesses, they paused their whatever.
Mhm.
Someone, okay, probably planning for a wedding, and all of a sudden, oh, the dad had a stroke, and then they have to relocate to go and be taking care of the dad, and the burden is just so much. Sometimes they're going to get tired and frustrated.
Mhm.
So when they come to the hospital, you do not try. We do not want to now add insult on injury. We do not want to now come and make the thing worse for them by trying to maybe gaslight their emotions or pump pressure on them, performance pressure on them. Oh, you are meant to be doing this, or you are meant to be doing that. Sometimes just encourage them as well.
Just encourage
Yes.
them as well. All right. So, from your perspective, because I have a question here from Abraham from Mintama. So, I'm just trying to coin the question properly. From your own perspective as a CBT life coach, okay, how do emotional and mental health challenges impact stroke recovery, and what strategy or strategies help stroke survivor build resilience, because we need to talk about it. So thank you so much, Abraham from Metama, for your question.
Okay. So good. Now, the for a lot of patients, um, I told you that they experience this psychological issues,
Hmm.
depression, anxiety, frustration, weeping spells, and simply because I used to be like this. I used to be a very active person. I used to live an active lifestyle, and all of a sudden, I am this way. I am more like a vegetable,
Hmm.
right? I
Hmm.
can't do all the things that I used to do.
Hmm.
Now, for some people, there's a limiting mindset that comes with it. For some people, they feel like, oh, anything you want to do, they say, this my hand is not good, right? Try and hold this. No, I can't do it. I encounter that a lot, right? And being into the CBT space, cognitive behavioral therapy or cognitive behavioral technique, I try to use some of the tools to actually help them. Now, one of that is rewriting the vocabulary, removing the limitations existing. Oh, I can't do this. No, don't say you can't do it. There's actually potential here. There's potential for this activity. You can actually do this, so you should give it a try. I can try, so helping them to work on the mind, to realize that, oh, the fact that you had a stroke is not a death sentence. It's not the end of the journey here. There's still a lot of recovery that can be done. You meet some of them and they'll tell you, oh no, this side of my body, I can't use this side, I can't do this, I can't do that, this one is just not good. I had I met a patient one time, and the battle was, she wanted to write, but she couldn't hold her pen and write. Now, each time I ask her, okay, what are your goals for therapy? What are your goals for physio? She had already started her recovery journey. She was doing way better. But then that writing was a concern. Now she was like, I want to write. I want to be able to write. Okay, so what's stopping you? She says, I can't write.
So that word can't.
Yes. So when she said, I can't write, I said, that's not true. Have you tried? She's like, when I write, you can't see my writing. My writing is very bad. It's just so terrible. So I gave her a paper. I gave her paper and pen. I said, write. And she wrote something. To her surprise, I picked up what she wrote and I read everything. I told her to write me a story.
So it was like a relief for her.
Yes.
Someone could actually read.
So she wrote a story. She wrote me a story about her family, and I read it before her. She was shocked that I was able to see what she was writing, and I told her, "Can't you see?"
To be honest, wasn't it stressful a bit?
It was a bit for me. I feel like reading people's writing is a gift I have. I didn't used to write much in school, so I had to borrow a lot of notes. So it's an advantage. I had to borrow notes a lot, so I had to read different kinds of things.
Oh, wow.
Exactly. But to an extent, it was fair enough. And I told her, this is what it is. Now, what I told her was, every time when you go home, get a notebook, start writing stories. So whenever you come, you're going to come and show me the stories that you've written, right? So those are part of the things that we do. Now, pin to purpose stories, redrafting, rechanneling, rewriting their life stories. Okay, this has happened to you. One of the reasons things happen to us, adversity comes to us, or pain, one of the reasons we experience pain is so that we can learn from that experience. So there are things you must have acquired. One is that you are in a better position to tell people, okay, this is a lifestyle that I lived that, I believe probably ended me here. Right? You're going to be able to empower more people. You can talk at events, you can write books about this, about your experience, your journey in a very unique way, right? Because as medical experts, right, we are only able to understand very well from the perspective of research and then our experience with patients. But if you have not experienced a thing by yourself, there's a level of understanding you may not have. So I try to introduce them to that concept. Okay, there's actually a lot you can do, and then they spark up. Now, for some of them, particularly retirees, at the point of retirement, and then they have a stroke or something like that, and they feel like my world has ended. Right? There's nothing I can do. I have retired. I'm not really so useful to the society. I help them understand that the fact that you're retired and you have a stroke is not the end of life. There's still a lot that you can do. You can talk, you can write, you can do this and that. So you can actually put something together that will give value to your world. And then when I talked about paying to purpose stories, this thing that has happened, you can use it as an opportunity to encourage other people who are going through the same thing, or who are in your yesterday. Because I tell people this, your yesterday is somebody's tomorrow. So that period, at the point of the initial phase of recovery, when you were not able to raise your hand and you thought it would never come up, you were not able to move your leg and you thought it would never move. But here, look at where we are today, right? So it means that you're going to be in a good position to actually encourage other patients who are also in that phase and let them know that, don't worry, it's going to be better. Look, I was here. So those are some of the strategies that I employ to actually help lift up the spirits of my patients who are going through that.
Nice. That's really nice. Thank you so much. In case you just tuned in, you are listening to Health and Wealth Show. Welcome you to Grand South. This is still Democracy Radio 104.9 FM, reaching the information now. Okay. Uh, we still have a few, couple of, we still have a few more questions for you, Doctor. Hope you don't mind.
I don't mind.
Okay, because I'm really, really enjoying this conversation and I'm learning new things. And I hope you also are learning new things this wonderful morning. Please make sure you don't take this for granted, okay? World Stroke Day is something we need to talk about every day. It's so sad that not just adults, you know, get hit by this on what now should we use on healthy or what is the right word do you think we can use so
Um, um,
we don't
um,
say wrongly.
mm,
It's a disease,
it's a
infectious
disease.
disease, okay?
Yeah.
So you don't want stroke to hit you while you're young. These are things you should not take for granted. Make sure you stop drinking, stop smoking. If you're based, walk out. Exercise should be your friend, okay? Now that is why physical activities come into play. If you don't exercise yourself regularly, your body regularly, you need to stop doing that. And if you are hypertensive, don't joke with your health. Make sure you check
Mhm.
your BP regularly and then you do the right things for your health. And remember, your mental health is also important. Don't let stress be your boyfriend. Don't let
Mm.
stress be your friend. Make sure you kick it away by meditating. Go out, see the nature, walk barefoot dead or barefoot on grass, and then the next one we need to talk about is hog trees, but be careful of the kind of tree you go to. So there are ants and everything won't get to bite you. It is very also that one is important. Don't I don't man say, Trish, you said Remember where I said when you want to hug the tree, look at the tree before you hug it because this is our nature and it will help
That
you.
sounds so scary.
Don't, don't forget to drink water. Stay hydrated every single time. And happy. Be happy. Happiness is free. That is why whenever I kickstart this show, I play this great song from Pharrell Williams, Happy. I love that song from the bottom of my heart. So, what are effective prevention strategies we can use to prevent stroke from hitting our lovely people right about now?
Okay. So, number one preventive strategy is education. It's education. So once people know more about this, this deadly disease, they can be in a better position to actually avoid it or prevent it, right? And there are preventive measures. I already mentioned that these preventive measures are basically tied to, working on the modifiable risk factors,
Mm.
So eat well, eat healthy, stop eating too much junk.
Stop eating junk. Not too much, but
Stop,
basically,
stop, stop.
because the flour now, it's when you want to go buy meat pie or fish roll or egg roll, they yeah,
Is
but
there even fish inside the fish roll?
I'm on fish they did, but it's not plenty. It smells like fish inside of it. So avoid snacks, okay, and avoid soda.
Exactly.
More of water, more of fresh fruit
Fruits,
and
vegetables.
yeah, which is good. So before I let you go, Dr. Chijoke Otipa, he is a physiotherapist and a holistic coach. Before I let you go, what would be your advice and what do you have to also say to the Democracy Radio 149 of Abuja?
Okay. First off, I would want to address the sufferers, right? People who are living with stroke. And I want to say that stroke is not the end of life.
Mhm,
Okay.
mhm.
Um, it's all about optimism. You have to be optimistic about the future and about your recovery. Take the recovery into your hands. Ask the right questions. Work closely with the medical team. Tell people how you feel. Anybody who is around you, what you want. Communicate effectively, right? And then on the path of those who are watching, this is actually preventable. And I believe so much in preventive healthcare.
Watching or listening? I mean, watching and listening.
Watching and listening.
Okay.
What did you say?
Watching and listening. So for those of you who are watching, are you
Oh, I said watching. I said
Yeah.
watching. Oh,
You see,
oh.
I hope it's not my third place. Please. Stop it.
No, 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 no. The economy is not even allowing me to look at anything now. Okay, so
For those of you who are watching and listening, because I know
yeah, for those of you who are watching and listening, you know, encourage people as much as possible. Help anybody who is going through this situation. It's not contagious. Come on. So and then this is a preventable illness. This is
and
preventable. It's not
transferable. It's
ex-
not as if when someone sneezes and you,
yeah,
it's not a
yeah,
transferable
yeah,
disease.
yeah. So as much as possible, take to this. If you're having too much headaches, go to the hospital, get yourself checked. If you're having hypertension, get checked regularly. You know, eat well, sleep well, don't stress yourself too much, you know, and hopefully you would keep taking the right steps towards your health. Have an amazing day.
What about what do you have to say to the Democracy Radio?
Oh, Democracy Radio, keep doing what you're doing. And I'm going to recommend, you know, everyone here, keep joining Democracy Radio. 104.9 FM. I got it. 104.9 FM. Keep joining in and stay connected with Health Fish. Amazing job you're doing.
Thank you so much. I appreciate it. Well, I'm blushing. All right, so this is the size of package we can take for today. Do well to make sure you keep being an amazing version of yourself. And my advice to you, my piece of advice to you listening right now is do the inner work, okay? Get 7 to 8 hours of sleep daily, right? You are what you eat. So please start eating healthy. Drink your water because your body needs it. It's the energy to, it's the flow your body needs to kickstart every day. Okay, learn to meditate. Open a journal and write down your emotions because it's important. If you don't have sincere friends, I'm a sincere friend, so you can talk to me. But in case you don't have it, make sure you just get a journal and write down your emotions. Exercise your body because your body deserves it. I tell you, you will thank your body. You will thank your body will thank you for exercising regularly. Okay, fall in love with reading. It is important so you can help yourself. You can grow every single day and find a creative pursuit. When you don't make time to take care of yourself, eventually you will make time for illness because your health is your wealth. This is where I will say my thank yous. It has been an amazing time for you who listened, for you who sent in your messages, and for you who tried to call in but it didn't go through. I appreciate you regardless of on still. To also follow us up on social media, Facebook, Instagram at Democracy Radio 104.9 FM Abuja. And on X is Democracy Radio underscore. You want to follow me up on my socials, Facebook, Instagram, and TikTok is Trish the Goddess. And on X and YouTube is Trish underscore D underscore Goddess. Make sure you are happy and make sure you are free. Stay blessed and keep listening to Health and Wealth Show and also keep listening to Democracy Radio 104.9 FM Abuja, reading the information that you need. Thank you. How did you go? Why are you laughing?
I almost started dancing. Then I remembered I was live. I didn't want anybody to see my dance moves.